So, hello everybody, how are you?
Hello, I'm fine and you?
Okay, very well, thank you. I have prepared on my laptop some pictures to show what we have done so far, only for the right leg of Mehmed and how it looks like and where we are heading as well.
Très bien.
You have a question accordingly?
Pour l'instant, non. On verra en cours de présentation. Il y aura sûrement des questions.
Okay, so let me show you the presentation. So this is my classification for Tibial Hemimelia. In total 12 types, starting from type 1 to type 7, including subtypes. Your child has type 2 on the left side and type 7 on the right side. Type 1 or type 2 is much less severe, and the most severe is type 7. And we are talking only about the type 7 today. Okay, so this is the situation. There's only a femoral bone, a fibula bone, and a foot. There is no shin bone, there is no knee joint, there is no ankle joint. This is the situation. And usually this 7b has much less construction options for a joint, but we need to have a knee joint. And in your child, we have a kneecap. And this is very good because I have designed surgical technique to use the kneecap as a joint partner for the femoral condyle. So with this kneecap, I can construct a knee joint. And how this will look like, and this makes automatically this severe type to a much less severe type. So from 5- to 4. So 4 is much better than 5-. So, and this is what we have done already in your child. So we have used the kneecap as a joint partner, put the fibula into the kneecap, centralize the foot, stabilize the foot with the periosteum, this is the skin of the bone, stabilize this so that we have a knee joint. We have the fibula as replacement as a kind of shin bone, and we have the foot stable, adjusted to the fibula. This was before, now we have this situation, which is much better. So this was when I saw the child before I did any surgery. Unfortunately, he was treated in another hospital before where they didn't use my techniques. This was the first time I did my procedures, and here we prepare for doing the destruction in order to do the joint construction according to my techniques. And this is now the situation. So we have done already all the knee construction situation, and now we have to solve the problems, which is now that this knee joint is not moving properly, and this lower leg with the fibula is too short, and also the foot shows some deformities. So, and also the foot is too much rotated inwards. So this also has to be corrected. Here I have done an osteotomy on the upper part of the femoral of the thigh bone and corrected the inward rotation deformity of the foot. A little bit is left, and this we will correct with the fixator. So this fixator here, this hexapod, is doing now the job of deformity correction of the foot in multiple levels and the lengthening of the lower leg. Okay, and these are now the x-rays we have done after the surgery. This is 17 days after, and here you can see a gap as well as you can see a gap here. This is when we look from the front, this is when we look from the side. I can magnify this a little bit. So, and here we see there's a nice gap. There we do the lengthening of 17mm, just matching with the 17 days of destruction. And when we look on the lateral aspect, we see here also 17 centimeter of a gap. This is the dorsal part of the foot. From the, we look from, here's from the hind of the foot, and here's the front of the foot. And here the gap is 17mm, here's less because we are correcting the deformity of the foot. So, and if we look at the animation, this was 0 day of correction, you see here the bone is bent forward and the foot is bent downward, okay? And now 17 days later, we have already a very nice correction. It's not finished yet, we have to come to 40 days, but the foot, as you see, is already very nicely corrected. It will be correct more, but we see already the effect. You see here the front of the foot is more down and here it's more up, okay? And you see also here it's the deformity and here it's more straight. Did you understand everything from the presentation?
Oui, très bien.
Do you have any question?
La mobilité de son genou, comment ça va se passer?
We are not taking care of the knee at the moment, because with the length, the knee already has too less range of motion. So this we have to improve, and we will improve it at the end of the treatment. Now we are concentrating on the deformity correction and of the lengthening, because with the lengthening, with the deformity correction, also the range of motion of the knee will be compromised. So it's better to wait until we have done the lengthening and the deformity correction. So once we have reached the complete lengthening and the complete deformity correction, then we have to do a little remountage of the fixator, and then we start doing the flexion.
Et là actuellement pour l'allongissement qui se passe actuellement, ça se passe plutôt bien, c'est prévu pour combien de mois l'allongissement?
The total amount was, I think, something like 7 centimeters.
Là en fait 17 mm, ce qu'il dit.
1.7.
1,7. Ok.
All good? So I'm very happy with the procedure. Everything went according to plan. So we go ahead. Once we have reached the 40 days, you will get another plan, because the 40 days, then all the deformity will be corrected and we go for the rest of the lengthening to achieve the whole 7 centimeters. So thank you for coming and see you soon.